Hello everyone, and welcome back to another Medicise video. Now the first topic we'll be covering is colectomies. So this is an extremely common procedure in general surgery which involves removing part or the entire colon. Now before we go into the types of colectomies, let's familiarise ourselves with the anatomy of the colon. So we have the small intestines over here. We then go into the cecum, which is the first part of the large intestines. The tail coming off is the appendix. So if we go up, that's the ascending colon. So this bit is the hepatic flexure. Good way to remember this is because it's near the liver. You then go across the transverse colon to the opposite side, which is called the splenic flexure. So a good way to remember this is that the spleen can be found here. Hence it's called splenic flexure. You then come down the descending colon into the sigmoid colon. Then you've got the rectum and then the anal canal. So that's just a quick recap of the anatomy of the colon. So as we mentioned, you can get multiple types of colectomies. You can get a left or a right hemicolectomy. You can get a subtotal colectomy, a panproctocolectomy, anterior resection, or an abdominoperineal colectomy. Now once the colon is removed, the feces produced needs a form of exit. Now this could be the back passage, i.e. the anal canal, as we normally pass stools. However, if the colon removed can no longer allow the feces to be passed into the anal canal, there needs to be another opening, and this is called a stoma. So a stoma is an opening in the abdominal wall which allows a passage for the feces to be excreted. Now there are two types of stomas, an ileostomy and a colostomy. Now one way to distinguish the two, just by looking at a patient, is that majority of the time, ileostomies are located in the left iliac fossa. Now this is where the ileum is brought out into the abdominal wall. Now a colostomy is often located in the right iliac fossa, and this is when the colon is brought out into the abdominal wall. So ileostomy is to do with the ileum being brought out. Colostomy is to do with the colon being brought out. Now other ways to differentiate the two is that in an ileostomy, a spout is present. So if you have a look at this picture, you notice that there's quite a bulge, which we call a spout. And that's present in an ileostomy compared to a colostomy, where there won't be a bulge, it would be flush to the skin. A spout is used for ileostomies because the small bowel produces contents which are irritating to the skin. So to prevent skin irritation, a spout is formed. Whereas the large intestines doesn't produce this irritant, so the stoma can be flush to the skin. Another difference is that ileostomies contain liquid feces compared to colostomies, which have formed stool. Now the function of the large intestines is to reabsorb water, making stool more solid in comparison to stool still in the ileum. So in ileostomies, stool is passing through the ileum and out through the ileostomy bag. So that means the stool doesn't go into the colon at any point, so water is not reabsorbed. Therefore, in ileostomies, the feces are still liquid stool because of the increased water content. Compared to colostomies, which means that the stool passes through the ileum and part of the colon to come out into the colostomy bag, which means that water can be reabsorbed in the colon, forming formed stool. Now, sometimes the stomas can have one lumen, called an end ileostomy or an end colostomy, or they can have two lumens, called a loop ileostomy or a loop colostomy. So a one lumen, i.e. end ileostomy or end colostomy, refers to a permanent stoma. The patient will be living with the stoma for the rest of their life, whereas two lumens suggests that the stoma is temporary. Okay, now I'll explain this further as we talk about the different types of colectomies, but sometimes the stomas can be reversed. Two loops of bowel can be rejoined together in the future. Now, how much of the colon removed is based on the type of colectomy performed. So let's start off with the right and left hemicolectomy. So a left hemicolectomy means the left half of the colon is removed. So this includes a portion of the transverse colon, the splenic flexure, the descending colon, and part of the sigmoid colon. Whereas the right hemicolectomy means that the right half of the colon is removed. This includes the terminal ileum, the cecum, ascending colon, hepatic flexure, and a portion of the transverse colon. So in the diagram, the yellow parts of the diagram represents the portion that's being removed in the surgery. Now, the reasons for conducting a hemicolectomy is often due to colorectal cancers and inflammatory bowel disease. So when the left or right part of the colon gets removed, Sometimes the remaining bowel can just get joined together. So let's say we remove this part of the colon. This part and this part will then just be rejoined together. Now, during the surgery, because we're manipulating bowel quite a bit, we can sometimes form a temporary stoma. We pull this part out to the abdominal wall and this part out to the abdominal wall. And that's to allow the rest of the bowel to heal because it has been manipulated quite a bit during surgery. After a couple of weeks, we can then take this side of the bowel and this side of the bowel and rejoin it together. Now, the rejoining of the bowel is called anastomosis. That's why you would get a loop ileostomy or a loop colostomy, because you would get a double lumen. So this part of the ileum would come out and this part of the colon would come out into the abdominal wall to form a stoma. So a left hemicolectomy will need a colostomy, and that's because the colon will be brought out into the abdominal wall. And in a right hemicolectomy, this leaves the ileum to be unattached, so that an ileostomy will be needed. Then the next type of colectomies is the subtotal colectomy and a panproctocolectomy. Now, these two are fairly similar. So the subtotal colectomy involves removing the majority part of the colon, but not the rectum and the anal canal. Whereas in a panproctocolectomy, the entire colon, including the rectum and the anal canal, is removed. So the subtotal part highlights that not everything is removed. Whereas pan, in panproctocolectomy, means all, and procto means anus. So the whole colon, including the anus, is removed. This might be needed again in inflammatory bowel disease or even familial adenomatous polyposis. Now, this is a genetic condition which can cause extra polyps to form in the large intestines and the rectum. Now, if this is left untreated, the polyps can likely become cancerous, and so you have an increased risk of developing colorectal cancer. Now, for a subtotal colectomy and a panproctocolectomy, a permanent ileostomy will be required because the majority of the colon is being removed. Therefore, you're not able to rejoin any bits of the colon together. So you have a permanent ileostomy, and that's because the ileum is being brought out, and you would only have one lumen because it's an end permanent ileostomy. Now, the next type of colectomy is anterior resection. Now, the anterior resection just refers to the sigmoid colon. Now, this can be split into high anterior and low anterior resection. High anterior resection means removal of the sigmoid colon without the rectum, whereas a low anterior resection involves removal of the sigmoid colon and the rectum. So high anterior means that the sigmoid alone is removed. Low involves sigmoid and rectum. And this is often for rectosigmoid cancers. Now, the final type of colectomy is called the abdominoperineal colectomy. Now, this involves removal of the sigmoid colon, the rectum, and the anus. So where anterior resection involves sigmoid and the rectum, abdominoperineal colectomies involves the sigmoid colon, the rectum, and the anal canal. Now, this is also known as the Hartmann's procedure. So this will result in a permanent colostomy bag being on the left side, and instead of removing the segment, this part of the rectum is closed and not the anus. So contents can still come out of the back passage. So for example, the stump will still have a blood supply, so patients may bleed post-operation. And additionally, as the colon produces mucus, generally, this rectal stump will also be producing mucus, which may come out of the back passage as well. So at the end of each video, we'll have a short quiz at the end to ensure that any of the information that you've learnt are being reinforced and clarified. So there are 6 questions in this quiz. Each question will last 15 seconds. If you feel like you need more time, feel free to pause the video at any point. So let's move on to the first question. What conditions are associated with right upper quadrant pain? Okay, let's have a look at the answer. So in the right upper quadrant, you can find the liver and you can find the gallbladder. Now, most patients with right upper quadrant pain present with gallbladder symptoms. So that includes biliary colic, cholecystitis, and cholangitis. Okay, let's move on to the next question. In diverticulitis, which 2 parts of the abdomen is the pain commonly located in? All right, let's have a look at the answer. So it's the right and the left lower quadrant, and that's because the colon can be found here. Okay, question number 3. What type of colectomy involves the removal of the entire colon, including the rectum and the anal canal? Okay, let's have a look at the answer. So it's the pan-proctocolectomy. So pan meaning all, procto meaning anus, so essentially meaning removal of the entire colon, including the anal canal, whereas a subtotal colectomy means removal of the entire colon except for the rectum and the anal canal. Question number 4. How can you differentiate between an ileostomy and a colostomy just by looking at the stoma? All right, let's have a look at the answer. So an ileostomy most commonly occurs on the right-hand side. There is a spouted lumen and it often contains liquid feces, in comparison to a colostomy bag, which is found on the left side with no spouted lumen and often contains formed feces. Question number 5. What is the difference between high anterior resection and a low anterior resection? Now, a high anterior resection means removal of the sigmoid without the rectum, whereas a low anterior resection means removal of the sigmoid colon, including the rectum. Okay, final question. So in this diagram, the yellow part represents the part of the colon that's removed. Now, what type of colectomy is this called? Okay, let's have a look at the answer. Now, this type of colectomy is called an abdominal perineal resection. Now, this involves removal of the sigmoid colon, including the rectum and the anal canal. All right, well, thank you so much for watching. Now, if you do like this video, please do like, share, and subscribe. We'll be posting every Tuesdays and Thursdays. And if there are any other topics that you'd like us to cover, please do comment below. Hope you have a great day and see you in the next video.